when we go into market with what we're saying are really unique, differentiated devices, and they really are.
So she's got an intraventricular conduction defect, but not a baseline right
My feeling is that,
to the braid. Around here is the belly of the leaflet. This is where we're going to be attaching it to other two leaflets.
You've heard about the dynamic and changing TAVR landscape. You've heard about Lotus and Lotus Edge, the technical specifications, the people that made it all happen. And now you're going to hear from some of the thought leaders about the way ahead.
Lotus Edge is one of the centerpieces of a whole new era for the company in structural heart. But it's going to be backed up with just so much more to come in terms of portfolio breadth, and it's going to really transform our company and our division in ways that many don't see in an entire career.
So with that unique portfolio, we're going to be totally different on what we can offer that patient, and we're going to be looking at that patient in its totality, not just in that one space.
This is an incredibly important category for us. We think that many patients are waiting for better solutions. The technologies, the investments we've made are going to position us very nicely here. Well, let's start with the Safari wire, the best TAVR wire in the world. We acquired the Accurate valve, fastest growing valve in Europe, and over 20% market share in countries and markets where we've launched. We invested in the iSleeve expandable sheath. So this enables us to make sure the vascular complications are very low. It enables us to treat more anatomies. We acquired the Sentinel technology. Stroke prevention is going with the grain for patients and our physicians. And then lastly, with the great news of Lotus Edge, it really puts the capstone on an incredibly broad, comprehensive portfolio that makes a great difference in the world.
We'll take a little 6, please, short 6.
We've made our mark and our contribution on clinical value. It's having the right product for the right patients.
The Lotus Edge is a critical and key component of Boston Scientific's structural heart portfolio. That includes the Watchman left atrial appendage occlusion device and its future iterations. That includes future mitral and tricuspid valve technologies, and includes future iteration of the transcatheter aortic valve itself.
We've already got the next few generations of Lotus Edge being lined up. We have the Mantra valve, which will continue to focus on lowering pacemaker rates.
And we're going to do the same with mitral. Aggressive, smart bets that we've placed in the field of mitral. It's a super exciting time for interventional cardiology. There's so many different areas to invest in. And Boston Scientific is uniquely strong in interventional cardiology. I see just tremendous opportunity over the coming decade, really, as we continue to transform how patients with valvular disease are treated.
So on Lotus Edge, we have the full package. We have a manual mechanical valve that allows you to lock and unlock. We have an adaptive seal that completely obliterates paravalvular leak. Flexible delivery catheter, depth guard technology, all conspire to make the most modern and sophisticated heart valve there is. And it's so important in therapy that any future iteration can't be just good, it has to be great. But the benefit of the technology is only relevant if it directly benefits patients. All this reflects the relentless, unwavering desire to continually improve the quality of patients' lives.